PNP nurse Practitioner questions and answers. 100% pass. List drug options that will cover as Pseudomonas. Answer: ceftazidime, cefepime, piperacillin/ticarcillin, meropenem, imipenem, aztreonam, fluoroquinolones. Aminoglycosides. Describe the differences in CSF findings between bacterial, viral, and herpes meningitis. Answer: bacterial, decreased glucose and highly increased WBC, lactate protein. Diff-PMN. Viral, glucose normal and lactate normal or decreased, protein and WBC mildly increased. Diff-PMN, first the monos. Herpes, glucose normal, protein and WBC increased. Diff-PMN, then monos, RBC. Greater than 1,000 in absence of traumatic tap. List signs and symptoms of malaria. Answer: fever, CNS dysfunction, anemia, hemoglobinuria, sweats, chills, HA pulmonary edema, NNV, coagulopathy, myalgia, shock, fatigue, renal failure, hepatosplenomegaly, metabolic acidosis, tachypnea, hypoglycemia. Third-generation cephalosporins cover which organisms? Answer: gram-positive. Henpeck, Serratia, ceftazidime also covers Pseudomonas. Review the signs and symptoms, course, and treatment for the two organisms causing toxic shock. Which is worse? Answer: early symptoms equals pain is the most common initial symptom. Fever/hypothermia, confusion, soft tissue infection, positive blood culture. 60% or rash. Pyogenes causes hypotension. 2 of T following: renal dysfunction, coagulopathy. YARDS, tissue necrosis, erythematous rash, skin desquamation 10 to 14 days after onset. High mortality, TX with supportive care, clindamycin and debridement. Aureus, fever, hypotension and rash, involvement of 3 or more organ systems. Absence of Rocky Mountain spotted fever, leptospirosis, measles, mono or syphilis. High morbidity. Treat with supportive care, nafcillin, vancomycin for MRSA, and debridement. State 1 major pediatric fears for each of the following: psychosocial, cognitive, and moral development. Answer: psychosocial, Erickson. Cognitive, Piaget. Moral, Kohlberg. At what age should children first be able to combine words? Answer: -18 months. Erickson stage of industry versus inferiority coincides with which Piaget stage? Answer: concrete operations. 1/3. What are the adverse effects of ginkgo biloba? Answer: bleeding events R/T inhibition of platelet activating factor, subdural hematoma, cerebral hemorrhage, hyphema, and post-op bleeding complication S. Increased CBF may result in increased ICP. May potentiate anticoagulation. What is St. John's wort used for, and what are the adverse effects? Answer: used for mild depression, generally well tolerated, headache, GI disturbances, phytophotoxic. Dermatite is reduces plasma levels of protease inhibitors. Name 2 classes of medication that can be used as adjuvants to treat pain. Answer: antidepressants or anticonvulsants. Name the 5 cranial nerves important to eating. Answer: V. Trigeminal SM, 7 facial. SM, 9 glossopharyngeal SM, X vagus M, 12 hypoglossal M. Describe epidural hemorrhages. Answer: epidural, between inner table of skull and dura mater, lenticular shape, do not cross hemispheres, often follow middle. Meningeal artery tear, period of lucency followed by decreased LOA, emergent surgical. Evacuation if symptomatic. Describe subdural hemorrhages. Answer: subdural, between dura mater and arachnoid, may be associated with a skull fracture, often bilateral and will cross hemispheres. Symptoms may be acute or insidious ICP. Surgical evacuation if symptomatic. Describe subarachnoid hemorrhage. Answer: subarachnoid, between arachnoid, and pia mater, severe headache and neck pain, surgical evacuation if symptomatic. Name and describe the type of migraine typical to adolescents. Answer: common. Migraine with T aura, throbbing or pounding headache that is usually unilateral, may have nausea and vomiting, often relieved by sleep. Summarize signs and symptoms of depression. Answer: usually coherent and clear. Thinking, history of deterioration of school activities, weight gain/loss. Lethargic/apathetic, anxious with angry outbursts, sleep disturbances, may have. Suicidal ideation. Describe pertussis course, diagnosis, and treatment. Answer: course catarrhal. Phase: paroxysmal phase, convalescent phase. I have findings of pneumonia, otitis, seizures, or encephalitis. Diagnosis: lymphocytosis, Bordetella pertussis, a coccobacillus. Treatment: erythromycin. Review the signs, symptoms, and etiology of Guillain-Barré versus botulism. Answer: Guillain-Barré may follow non-specific viral infection or commonly Campylobacter. Landry's ascending. Paralysis. CSF is notable for few white cells and high protein. 2/3. Botulism, Clostridium botulinum, a gram-positive anaerobe. Rapid descending. Paralysis. CSF is normal. Avoid antibiotics. Answer: what is transient tachypnea of a newborn? Answer: usually follows uneventful. Deliveries may be related to slower absorption of fetal lung fluid resulting. Decreased pulmonary compliance and increased dead space. Usual Y resolves in approximately 3 days without therapy. Review the criteria for ARDS. Answer: acute onset of symptoms following precipitating infection of insult, frontal chest X-ray, bilateral infiltrates. No clinical evidence of LAHTN, PSO2 to FiO2 ratio /equals 200. Were the radiologic findings for asthma? Answer: asthma, flattened diaphragm, narrow cardiac silhouette, hyperinflation, narrow cardiac silhouette, peribronchial, thickening, subsegmental atelectasis. Describe methods to treat hyperkalemia. Answer: push K into cells, albuterol, insulin/glucose, sodium bicarbonate, remove K-xylate, dialysis, stabilize cardiac. Cell membrane, Ca chloride. What is the equation to calculate creatinine clearance in children? Answer: KXHT. Cm/serum creatinine. K equals premi 0.33, term 0.45, 2 to 21 years female, 0.55, 2 minus 21. YRS male, 0.70. Review the diagnostic criteria, treatment, and follow-up for urinary tract infection in young children. Answer: diagnostic criteria, unexplained fever, 2 Mohs, 2 years, plus nitrite. Test, plus leukoesterase test, 5 WBCs, colony count greater than 100,000, culture of 2 or less. Organisms, oral treatment and follow-up, amoxicillin, TMP/SMX, cephalosporin, treat for 7 to 14 days. US and VCUG to follow. Describe the signs and symptoms, lab findings, and treatment for nephrotic syndrome. Answer: signs and symptoms, edema, especially periorbital, H10, anorexia, ABD, pain, and/or ABD distension. Lab findings, albumin 250, hematuria, treatment, steroids, diuretics, sodium/fluid restriction. Albumin. What are some of the clinical findings with systemic lupus erythematosus? Answer: 4 or more of the following are diagnostic: malar rash of the face, Desquar rash, photosensitive ITY, oral ulcers usually painless, arthritis in 2 or more joints, pericarditis, or effusion, kidney disease, hemolytic anemia, leukopenia, thrombocytopenia, antiphospholipid antibody, anti-DNA antibody, false positive for syphilis, antinuclear. Antibody. Powered by TCPDF, www.tcpdf.org. 3/3.